Hey guys, welcome to another one of our videos, and in this video we're going to be talking about how to actually make sure that you keep your marketers to the hospitals, those hospital liaisons, compliant with services to avoid any potential problems with the law. And that's what we're going to be covering in this particular video. Now let me ask this question to you guys, right? Do you guys have hospital liaisons? Do you have the people that goes to the hospitals, or even what we call nursing liaisons? These are people who work directly for your company and they represent you to go into the hospitals and nursing homes or assisted living communities. These community liaisons, also known as marketers or sales, and they have these roles in providing care coordination and getting those referrals for you guys, for your agency. But your agency needs to be very careful that your liaisons, your community or nurse liaisons, do not overstep or go past their boundaries and violate any laws, violate any anti-kickback or HIPAA laws or Starks laws. When you're speaking to your nursing liaisons or marketers and you ask them to perform tasks such as, for example, coordinating any lab draws before the patient is even referred to you guys, or communicating with the DME companies before your patient is actually referred or discharged to your company, this can be considered a free service or gift to that hospital or to that referral source, and could be seen as a violation of the anti-kickback laws. Understand this, that penalties for such violations could mean fines even as high as $25,000 per incident and even up to 5 years of prison. Your liaisons need to make sure that they actually have the referral before even starting or creating or coordinating any care with that particular patient. Provide your referral sources, those discharge planners or social workers, with educational based marketing materials that can help them explain your services to the patients and to the families. By you providing this educational based materials, okay, this is a way for you to actually avoid any anti-kickback statutes. Now, to be able to help your liaisons avoid any HIPAA violations, do not have your liaisons ask for information on the conditions of patients that you even previously cared for at your agency. If that particular patient is no longer under your active care, this actually can be viewed as you looking for referrals, which is inappropriate and possibly a breach of HIPAA rules. Now, look, I understand you have been taking care of the family of a patient, and all of a sudden they go back to the hospital, the nursing home, and you just want to know how are they doing. Just because you care and just because you want to see how they're doing, this is still maybe seen as a breach of the HIPAA law. Now, you can check with the physician to see how the patients are doing and if he wants to continue any services. When that patient actually gets discharged from the hospital, one thing you can do to be able to be actually get your name in the list of that hospital so they know who or which agency, which home health agency was servicing that patient before they were even admitted to the hospital. There's one technique that I have, and I want you to actually give me a call right now or send me an email at info@homehealthsuccessacademy.com just for me to be able to show you that quick tip, and just tell me that when you call me or when you email me, how I make sure that if a patient ends up in the hospital, that that hospital knows to make sure that they give me a call when that patient is being discharged, even if my company or the company I work with is not even in the preferred list of that hospital. So that right there, if you call me or contact me, I'm going to share that small technique. But this is what I'm going to do. Actually, you know what? Forget it. I'm not even going to ask you guys to email me right now or call me. I'm just going to share with you guys right now. What we do is we have what we call an agency emergency card or an agency patient card. So what we do is when we admit a patient, in that card it's branded with our company name, our contact information, and it's going to say that this patient was previously serviced by this agency. Then in that card, it's going to have the patient's name, it's going to have their date of birth, it's going to have their address, it's going to have their top diagnosis and problems that they're facing, it's going to have a list of their most current medications, it's also going to have, the date that that card was printed. The same thing, it's going to be like a back-to-back thing. In the back, it's going to be contact information of the patient's current primary care physician. It's going to have information on previous hospitals that they stayed at. It's going to have information of previous facilities like nursing homes that they also were working with. Now, we're going to create that card when we admit a patient, and we give that to the patient for them to put in their wallet or their purse. The reason for that is now they have all that main contact information in there for them. It's theirs. We create it and we give it to them. Oh, we also include, their Medicare number and their Social Security number if the patient asks that their Social Security number is placed there. The reason why we do that is, guess what? When a patient gets admitted, they're going to be asked those basic information. So the fact that they already have that listed, they can hand that over to the admitting people so they can actually do a proper, what they call HNP, or a history and physical. But guess what? It says which home health is taking care of them. So when they take that information, the person that's admitting that person, the person that is inputting their information into the hospital chart, it's going to state there that they were previously with our agency. So right there alone, they have to technically put that in the patient's file. Why? Just in case that they might need more information that the patient cannot give to that facility or to the person that's actually doing the basic assessment of that client. So they may actually contact your agency, but guess what? There's an initial communication, your name is in there. More than likely, right, that hospital discharge planner, when the patient is being discharged, they will actually more than likely contact your agency for that. So I just wanted to go ahead and share that. If you want to see samples of that, we have that in more of our videos. We actually created a video that just talks about that particular marketing strategy. So you definitely should look into that. That is just one of the strategies that we actually do that makes us stand out, that guarantees, it lessens the chance of that patient being given to another agency. Okay, because hospitals, yes, they have their own agency. Yes, sometimes they have their preferred provider, but they also understand that the continuity of care of a patient is such an important thing, and they would rather sometimes give that patient to somebody who already took care of that patient, because there's a better chance that that patient does not return in the hospital, which prevents any problems with that hospital with billing Medicare. So that's just one thing that I wanted to share with you guys, but I hope that the tips that I shared with you guys in this video resonates with you guys, and understand that you should have a policy and procedure in place in regarding you and your team marketing to facilities to avoid any potential problems, especially for kickbacks and HIPAA law violations. So if you like this video, make sure you comment down below. Make sure you let us know what we can do for you guys. If you have any questions, please keep on sending those. That's our goal, to be able to make videos such as this to provide services and answers to people who are in the home health, the home care, or in the hospice industry. Have a great day, guys.